Welcome to today's lesson on arterial blood gas interpretation, or ABG for short. As nurses, understanding ABG values is crucial for assessing our patient's oxygenation and acid-base status. In this comprehensive guide, I'll break down everything you need to know about ABG interpretation in a clear, easy-to-understand way. An arterial blood gas test is a vital diagnostic tool that measures the levels of gases in arterial blood. This specialized blood test gives us critical information about a patient's oxygenation status and acid-base balance. By analyzing arterial blood samples, we can assess how well the body is oxygenating tissues and maintaining proper pH balance. Let's look at the key components measured in an ABG. First, we have pH, which tells us about the patient's acid-base status. PaCO2 measures the carbon dioxide level in arterial blood. PaCO2 indicates the oxygen level, while HCO3 shows us the bicarbonate concentration. We also measure base excess or deficit and oxygen saturation. Each of these components gives us vital information about the patient's condition. Now, let's focus on the normal values you need to memorize. The normal pH range is 7.35 to 7.45. PaCO2 should be between 35 and 45 millimeters of mercury. For bicarbonate or HCO3, the normal range is 22 to 26 milliequivalents per liter. These numbers are crucial benchmarks for identifying acid-base imbalances. For the NCLEX exam in clinical practice, here's your systematic approach to ABG interpretation. First, always look at the pH to determine if the patient is acidotic or alkalotic. Next, the PaCO2 to assess the respiratory component. Then, evaluate the HCO3 for the metabolic component. After identifying the primary disorder, determine if there's any compensation occurring. Understanding pH interpretation is fundamental. When pH falls below 7.35, we have acidosis. A pH above 7.45 indicates alkalosis. Remember, the body works hard to maintain pH within that narrow normal range of 7.35 to 7.45, as even small deviations can significantly impact body functions. Let's explore PaCO2 and its relationship with the respiratory system. PaCO2 is directly controlled by our breathing rate. When PaCO2 rises above 45, we have respiratory acidosis, often seen in conditions that decrease respiratory rate or depth. Conversely, when PaCO2 falls below 35, we have respiratory alkalosis, commonly seen with hyperventilation. Moving on to HCO3 or bicarbonate, which reflects the metabolic component of acid-base balance. The kidneys regulate HCO3 levels. When HCO3 rises above 26, we have metabolic alkalosis. When it drops below 22, we're dealing with metabolic acidosis. Understanding HCO3 is crucial for identifying metabolic acid-base disorders. Compensation is the body's way of maintaining balance. When a primary acid-base disorder occurs, the body attempts to compensate through either respiratory or metabolic mechanisms. In partial compensation, the pH remains abnormal but is moving toward normal. In full compensation, the pH has returned to normal range despite ongoing primary disorder. There are four main types of acid-base imbalances you'll encounter. Respiratory acidosis, often seen in COPD patients. Respiratory alkalosis, common in anxiety-induced hyperventilation. Metabolic acidosis, frequently encountered in diabetic ketoacidosis. And metabolic alkalosis, which can occur with prolonged vomiting. Let's review some common clinical scenarios you might see on the NCLEX. In diabetic ketoacidosis, you'll typically see low pH, low HCO3, and normal or low PaCO2. COPD patients often present with low pH, high PaCO2, and normal or high HCO3. Anxiety-induced hyperventilation shows high pH, low PaCO2, and normal HCO3. In sepsis, you'll commonly find low pH, low HCO3, and low PaCO2. Let's practice with our first question. Question 1. A patient ABG shows a pH of 7.29, PaCO2 of 50 mmHg, and HCO3 of 24 milliamps per liter. Which condition is most likely present? Answer: respiratory acidosis. Rationale: normal pH is 7.35 to 7.45. A value of 7.29 is acidic. Normal PaCO2 is 35 to 45 mmHg. A value of 50 is elevated, meaning CO2 is retained, respiratory cause. Normal HCO3 is 22 to 26 milliamps per liter. A value of 24 is within range, so there is no metabolic compensation yet. Question 2. Systematic interpretation. Question: when interpreting an ABG, what is the correct first step? Answer: Look at the pH to determine if the patient is acidotic or alkalotic. Rationale. ABG interpretation always begins with pH. A pH below 7.35 indicates acidosis. A pH above 7.45 indicates alkalosis. This directs you to investigate the respiratory PaCO2 and metabolic HCO3 components. For our third question, a patient has an ABG result of pH 7.48, PaCO2 of 45 ml at HCO3 32 mmHg per liter. How should the nurse interpret these results? A. Respiratory acidosis. B. Respiratory alkalosis. Metabolic acidosis. Metabolic alkalosis. Correct answer D. Metabolic alkalosis. Rationale. Normal pH is 7.35 to 7.45. A pH of 7.48 is alkalotic. Normal PaCO2 is 35 to 45 mmHg. The PaCO2 is 45, which is normal, so the cause is not respiratory. Normal HCO3 is 22 to 26 per eth. The HCO3 is 32, which is elevated, indicating a metabolic cause. Therefore, this ABG reflects metabolic alkalosis. In our final practice question, a patient has an ABG result of pH 7.37, PaCO2 of 50 mmHg, and HCO3 28 milliliters per liter. How should the nurse interpret these results? A. Uncompensated respiratory acidosis. B. Partially compensated metabolic alkalosis. C. Fully compensated respiratory acidosis. D. Values. Correct answer C. Fully compensated respiratory acidosis. Normal pH is 7.35 to 7.45. A pH of 7.37 is within normal range, but on the acidic side. Normal PaCO2 is 35 to 45 mmHg. A PaCO2 of 50 is high, indicating respiratory acidosis. Normal HCO3 is 22 to 26 milliliters per liter. A value of 28 is elevated, showing the kidneys are compensating. Because the pH is back in the normal range, this represents full compensation for respiratory acidosis. Let's recap the key points. Remember your normal values: pH 7 to 37.45, PaCO2 35 to 45, and HCO3 22 to 26. Always follow your systematic approach. Check pH first, then PaCO2, then HCO3. Understand how compensation works and familiarize yourself with common clinical scenarios. Regular practice with case studies will help strengthen your interpretation skills. Thank you for joining me for this comprehensive guide to ABG interpretation. With practice and these systematic approaches, you'll become confident in analyzing ABGs in both your NCLEX exam and clinical practice. Remember, additional resources are available on our platform to help you master this essential nursing skill. Keep practicing, and you'll be interpreting ABGs like a pro in no time.